Hello, everyone. Welcome to Egora versus Headlines. I am your host, Cezary Jurevich. Now, this is a pilot episode of a new program I am doing on this channel, which again is called Egora versus Headlines. In this program, I'm going to be presenting and analyzing a news story that I find interesting or in need of addressing publicly. I will be giving you my own personal opinion on the situation, and then I will be raising an idea from within Egora, which I think best addresses the underlying problem behind the news story, hence the name Egora versus Headlines. But before we get on with the program, I want to tell you a little secret. I really don't want to be doing this show. What I'd really like to be doing is discussing the ideas inside of Egora with you. I want to be having real debates and discussions with live guests. So, if any of you are willing to discuss your ideas publicly with me, please join me on my other program, the Agora Experience, and let's have some serious fun. But okay, on with the show. So, this is the headline: Coronavirus to Swedes, it's the rest of the world engaging in a reckless experiment. So, you will find this story in the video description or the link to the story in the video description. I'm doing things really low tech, so I'm just going to be summarizing the story for you. I'm not going to be sharing any visuals. Um, but definitely check out the news article after watching the program. So Sweden is not imposing any restrictions on its citizens, schools, or businesses. People are still out in public, shopping centers, cafes, restaurants, sporting events. All of that is going on. People are free to choose to what degree they self-isolate. The government is asking people to be responsible, but not telling them what to do. They especially advise that the elderly self-isolate, but because they are at they're the highest risk segment of the population. But the big distinction is that the people are calm about the flu. They are not panicking about it. Life goes on as normal as much as they can in Sweden. Now, the reason Sweden is doing this is because they have a different strategy towards the coronavirus and, well, everything that's going on. They are concerned about the economic effects of the virus being worse than the virus itself, as the title of the article suggests. This is because the Swedes see the connection between unemployment, ruined businesses, lack of education, lack of pensions, and and lack of services, ruining and taking people's lives in the long term, in the big picture. So the state epidemiologist epidemiologist, you try to say that way, is basically running the country. His name is Anders Tegnell, and they are projecting the number of people needing intensive care to be manageable for all of their hospitals. One important thing is that Anders is not asking people to trust in his strategy, but they are making all of their data extremely accurate and completely public. They are tracking how many people are admitted into hospitals, how many people die, but specifically how many people die from coronavirus, not just people with coronavirus. Because not all statistics are doing that, and that can really skew the numbers to make COVID look much more dangerous than it potentially really is. So it's important that they're getting those numbers correctly. But the point is that if the strategy fails, the people will be able to see that right away. And so far, three-quarters of the Swedes support this strategy. At least that's the time of the article being published, which I think is about 2 days ago, 2 or 3 days ago. So the big question is this: is the strategy working? Is Sweden saving their economy? Superficially, it seems like a yes, but the economy is shrinking anyway. Because it is so dependent on the world economy. So Sweden is still going into recession, though not as bad as other places. Also, the rate of infections and deaths from COVID-19 seem to be on par with other countries and even ahead of the other Scandinavian countries. It's an interesting comparison. You know, you might want to compare Sweden to the world, but also to kind of more their counterparts in the same, um, well, Denmark, let's say, or Norway. So I guess it is more intensely spreading there, at least from the article. But the economy is not the only thing that the Swedes are trying to preserve. They're also trying to preserve their democracy. Sweden is a strong social democracy because they see the social infrastructure as necessary for maintaining of democracy, and they see exercising great caution in restricting people's freedom as also necessary for maintaining democracy. And it is this value of democracy that is causing them to be really cautious about possibly overreacting like the rest of the world. So that's basically the story. Actually, I was reading another article, which I also will link in the description. That was published like a day after, so that gives a little bit more perspective. But so, what do I think? This is the part. This is where I kind of put in my perspective. I actually agree with this article. I wish I was in Sweden right now. I could be outside, you know, hanging out outside, because it seems. But really, Sweden does seem like a country of sane, rational people, really uh, approaching solving problem solving, very fact based. I especially appreciate Swedes understanding how a healthy economy saves people's lives. And of course, I appreciate how cautious they are being about taking people's freedoms away, like basically freedom of assembly, one of the most fundamental rights, at least in the United States. The freedom of protected as a part of freedom of speech. Um, but of course, we have yet to see how this will all pan out for the Swedes. I was reading some other articles about this, and they're projecting that their lax stance will hit Sweden hard. Then again, maybe these projections are not really factual because if the virus spreads more quickly in the young people, because the old people are self isolating a lot more, but the young people are more exposed, then perhaps the young people that are out there and mingling, they will reach herd immunity more quickly, and maybe it will really slow down the spread of the virus to old people as well. So that's to be determined. But I guess to kind of summarize my opinion, I'm glad that there are some people out there who are brave enough to not lose their minds at the first signs of danger. They might be wrong, and they're actually, it's interesting that Swedes are pretty well aware of that they might be wrong, but they're being completely scientific about it, and that's just wow. I find that really important. And yeah, I just really appreciate their protection of the most fundamental rights of people to be outside. Yeah, I mean, how much more basic can you get? So now I'd like to offer you one of my ideas in my ideological profile that I think pertains to this issue that's behind this news story, and the whole coronavirus development going on around the world. Maybe this idea isn't directly related, to solving. Well, it's not really related to solving the crisis right now, but it's really being more prepared for these kinds of situations in the future, but also making sure that we have. Well, we live in a society where we have authorities that if we think that they if it comes to it that our personal freedoms have to be restricted, then the people who are doing that restricting, we can actually trust them, that they're going to be making the right decisions when our freedoms are restricted, not just getting carried away with it based on emotions or who knows, maybe financial incentives. So anyways, here's an idea. Here's my idea from my ideological profile. You can look that up when you register for Egora. You can find me. I'm giving this idea 4 points at this time. This The heading of this idea is handling of epidemics, preparation for epidemics, and so there are two sections. If a dangerous section one, if a dangerous epidemic appears in some country which has the risk of spreading to other countries, not naturally restricted to certain climates, the country must stop all physical connections with other countries to stop the virus. The country must apply quarantine restrictions and guidelines for its residents at least until contagion can be accurately tracked and assessed. In return, other countries must supply this country with medical supplies, medical personnel, food provisions, and other containment needs. Now, this is an idea, so I'm just going to comment real quick on this section one. So, this is an idea, and one thing to clarify, so some epidemics, they are restricted to certain climates, maybe like malaria only really spreads, it's an epidemic, but it only spreads in the tropical climates because it's spread by mosquitoes, which are really dependent on the tropical climate. So it doesn't really spread that much when you go further north or south out of that tropical zone. But I like this idea because I think it really recognizes that we're all in this together. And, sometimes when some society finds that they have this issue, if they take a hit for us and, clamp down on this and help the rest of us by restricting this virus from spread, or virus, it could be bacteria, it could be, well, it could be a variety of things. But so if they take a hit for us, then we should be helping them. Now, idea is not necessarily a law, but it's an idea, and I think this should be is something that we should be mindful of. So yeah, we should be helping out. And I heard that it's interesting. I heard that Italy was helping China with their situation. Now, just don't quote me on this. This is just what I heard. But they were helping China with supplies. And then when Italy needed help and they turned to China for help, China was trying to make money off of them. So I guess they wanted to sell the supplies back to them. I don't know. You'd have to look this up. But so, it's that kind of thing. I think we should be helping each other more in such situations because otherwise it's going to cost all of us. So, anyway, section two of this idea: an epidemic of a new disease does not just have a human life toll, but it also has an enormous economic toll on the entire society. Furthermore, this economic toll can have cascading consequences that have an even greater toll on human life than the epidemic itself by reducing access to healthcare opportunities, putting people in poverty, and even destabilizing society. Therefore, in order to prevent the worst case scenarios, our societies must be more aptly prepared for the most likely epidemics, especially those that rely on the respiratory tract to spread widely and quickly. Um, wow, there's a lot I'd like to comment, but I also don't want to lose track of this idea. So yeah, so some epidemics definitely, like COVID, is spread by uh, by breathing. So primarily, from my understanding, so like respirators, the fact that we don't have enough respirators, but that's in an epidemic. That's probably, if you have a quickly spreading epidemic, then respirators are going to be, well, if it's spreading quickly, then it's spreading by breathing, and so it's impacting your breathing system, and so we should probably have supplies on hand to, for. Anyways, let me continue with this idea. So, while the private sector of an economy can provide great flexibility, efficiency, and innovation in any industry, a private for profit healthcare industry is not capable of accommodating the healthcare needs of a sudden influx of patients during an epidemic. The reason for this is that being prepared for a sudden and unpredictable influx of patients requires uh, vast amounts of stockpiled resources, physical and human capital, which is against the financial interest of a for profit healthcare provider. For this reason, we require that the healthcare sector be augmented through public means so that we can be prepared for the most likely pandemics. The cost of such preparation will be significantly lower to the public than the cost of a devastating pandemic, as the COVID 19 pandemic has demonstrated. So that's the end of the idea. But so, really, the essence of this idea, what we're trying to say is that these pandemics have a huge economic effect, and these economic effects have a human life toll. If people are, well, if the economy isn't doing very well, then more people have less access to the things that they need to stay healthy. So it's really important that we do have a thriving economy. We're also saying that the private sector cannot be in itself prepared for epidemics because it's not in their business to be prepared, because that means they would have to have more resources on hand, and that means it costs them more money to keep these resources on hand. So it's not in their interest to keep those resources, and that's why we really need the public sector to be prepared for epidemics, pandemics. And that's the question of the free market versus centralized government provided services. And we're saying that for to be ready for epidemics, we really need the public sector. We cannot just solve this with the private sector alone. And so we need a good, strong healthcare system that's in some way supplemented by the public so that we're ready for these situations, because it's cheaper for us to be ready for these kinds of problems and have enough respirators, have enough certain supplies that never, well, that at least that don't expire, so something like that, so that so we don't have to shut down the economy to slow down the spread of the virus, so that the healthcare system can actually handle the influx of patients. So that's the idea. Hey, if you support it, or I mean, if you agree with this, please support it. This idea is, well, it's in my ideological profile in the Agora. If you have a better idea, please, introduce it. I'd love to hear it. Come on this show so we can discuss it. Actually, well, not on this show. I slipped. On the Agora experience. This is Agora versus Headline. This is the pilot episode. Uh, I hope this went well. I hope you enjoyed what you heard. I hope that gave you some food for thought. So please like, please subscribe. That actually really makes a difference on YouTube. And of course, I'm going to be putting up here, the link to the Egora presentation. People need to see this. People need to know how to use this technology so we can really take back control of the world governments. This is the technology that gives people real power. So please like, please subscribe, please check out the video, the presentation. You'll see in one of these corners. I really don't know. Thank you for watching. Welcome to the democratic evolution. The R is silent, and see you in the Agora.